afternoon and welcome to the JTG COVID-19 news brought to you by the Taolo Gaetsewe Developmental Trust. My name is Halele and it is a pleasure to be with you today. South Africa is currently sitting on 13,000 positive coronavirus cases, whereas JTG only had 3 cases. Today we have here with us Mr. Chuche, who is the project director for Taolo Gaetsewe Development. He will be telling us that why JTG undertook the screening program for the COVID-19. Thank you, Mr. Chuche, for joining us today. First things first, on Monday, the 1st of June, Trust will be starting with the screening program. Can you tell us about the key objectives for this program?
Okay, thank you, Ms. Halele. Good afternoon, Ms. Halele, and good afternoon to the viewers at home. As we know, the entire nation embarked on a mass screening program for coronavirus. So the Department of Health submitted a request to the JTG Developmental Trust to assist them with physical and financial resources to speed up the process of rolling out the mass screening and testing program in the entire JTG district. So the JTG Developmental Trust Board deemed it necessary to assist the Department of Health with the mass screening and testing program. What happened is that the objectives of this program is to ensure that we curb the spread of this disease so that we can relieve the social burden on our communities, and to ensure that we reduce the panic amongst our community members who really fear this disease.
Okay, we know that our district is very scattered. How many households do you intend to visit per day?
In total, we are intending to cover 12,500 households in a space of a month. So our target per day will be 1,000 households, because we have employed 100 volunteers on the program. So each volunteer has got a target of covering 10 households per day. So when you multiply that 10 by 100, it will give you 1,000. So in a day, we are targeting to cover 1,000 households.
Okay. If it happens that someone tests positive, like they have the symptoms of the COVID-19, what will then the process be for further testing of that person?
Remember, we are rolling out this project in collaboration with the Department of Health. So during the screening process, if we come across a person who has got the symptoms of coronavirus, we will immediately call the trained health professionals to come and take the swabs and conduct a test for COVID-19. We have availed 3 mobile clinics for this program, and those clinics will assist with conducting those coronavirus tests by trained health professionals.
Okay, we can tell that there is a relationship. This is in partnership with the Department of Health. Can you please tell us about your relationship with the department?
The Department of the relationship between the JTG Developmental Trust and Department of Health comes back from as far as 2012. There's a good collaboration between the Department of Health and the JTG Developmental Trust, and I think that relationship will be there forever, because we know the challenges on the health sector in general in the entire country.
Okay, lastly, Mr. Chuche, can you please, what would you like to say to the communities that will be visited?
What we require from the communities is cooperation, because at the end of the day, this project is being rolled out to assist them. So they should cooperate with the health, with the volunteers who will be going door to door doing the screening and testing, the screening process. So we require their cooperation, and they should be free to ask questions, and then they will be provided with answer by our trained volunteers. So those volunteers have been trained. They'll be carrying packs of sanitizers, so they'll be following all the health protocols that are required when conducting screening, especially in the households.
Okay, thank you so much for your time. And that's a wrap from me and the Taolo Gaetsewe Developmental Trust team. For more information, you can follow our social platforms, and tomorrow we will be visiting the following areas. Thank you.